Have you ever experienced a strange, unexplained sensation in your body that made you pause and wonder if something might be seriously wrong? It's a feeling many of us have had, and often ignored. But the truth is, your body has a way of signaling distress long before a full-blown health crisis occurs. Certain warning signs, even if they seem minor or harmless at first, should never be brushed aside. These symptoms can be your body's desperate attempt to get your attention, a final warning that something serious may be developing beneath the surface. When doctors encounter these specific signs, they don't hesitate. They act fast, because they know that what might appear to be a mild issue on the outside could actually point to something life-threatening on the inside. In this video, we're going to explore 6 critical warning signs that medical experts say could mean your health is in immediate danger. These are not just typical aches or fatigue after a long day. They're red flags that something deep within your body may be failing. From overwhelming exhaustion that doesn't go away, to severe chest pain, to unexplained weight loss or sudden confusion, each symptom is a message your body is sending you, one that should never be ignored. Stay with me until the very end, because understanding these signs and responding to them quickly could literally save your life. By learning what to watch for and knowing when to act, you give yourself the best possible chance to catch serious problems early and take control of your health before it's too late. Let's dive in and uncover the vital signs your body might be using to cry out for help. Before we begin, if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you enjoy this video, please type 1 in the comments. If you don't like it, type 0 in the comments to let me know so I can make better videos for you. Now let's get started. Number 1. Unexplained extreme fatigue. We all know what it feels like to be tired at the end of a long day. Maybe you've been working hard, taking care of family, or simply juggling too many responsibilities at once. That kind of tiredness is expected, and it usually goes away with rest, sleep, or a bit of relaxation. But what happens when no amount of sleep seems to help? What if you wake up just as exhausted as when you went to bed, even after a full night's rest? What if simple, everyday tasks suddenly feel like climbing a mountain? If this sounds familiar, you could be experiencing a very serious form of fatigue, one that should never be ignored. Unexplained extreme fatigue is not just being a little run down. It's a deep, unrelenting exhaustion that permeates your whole body and mind, making it nearly impossible to function the way you used to. This isn't the kind of tiredness that comes from staying up too late or having a stressful week. It's different. It's darker. It lingers day after day, often growing worse over time. You might find yourself struggling to get out of bed, even after sleeping for 8 or more hours. Things you once did without thinking, walking to the kitchen, folding laundry, making a phone call, having a conversation, now feel like monumental efforts. You may feel like your body is made of lead, like it takes all your strength just to exist. And the most alarming part? You can't point to any specific reason why this is happening. That's what makes it so dangerous. This kind of fatigue is often a warning sign that something deep inside your body is going terribly wrong. It may be the first clue that your organs are beginning to fail, that your heart is no longer pumping blood effectively, or that your immune system is using every bit of energy it has to fight off a silent but serious illness. Medical experts frequently observe this symptom in patients with life-threatening conditions like congestive heart failure, chronic kidney disease, autoimmune disorders, and various forms of cancer, especially those that progress quietly until they're far advanced. When the body begins prioritizing survival over functionality, it diverts energy away from less critical tasks. That's why even talking or thinking clearly can feel like too much. It's your body's way of conserving energy for the most essential systems, your heart, your lungs, your brain. One of the most crucial things to look for is a sudden change. Maybe you were active just a few weeks ago, going for walks, socializing, running errands, living your life. Then, without warning, you find yourself needing to rest after climbing a single flight of stairs. Or maybe you feel a gradual decline, where each day you have less energy than the one before, and you start avoiding activities you once enjoyed because you simply don't have the strength anymore. This is not normal aging. This is not something to brush off with, "I must just be getting older." This is your body telling you that something is not right, and that something could be very serious. If this is happening to you or to someone you love, don't dismiss it. Start by documenting when the fatigue began, how often it occurs, what makes it worse, and how it's impacting your daily life. Are you sleeping more but feeling worse? Are you unable to concentrate or focus? Are you withdrawing from social activities because you're too tired to interact? These are not signs of laziness, weakness, or age. They are symptoms, loud, persistent signals that your body is sending in hopes that you'll listen. And what should you do about it? The first step is to seek medical help. Don't wait for the fatigue to become so debilitating that you can't get out of bed. Don't assume it will go away on its own. See your doctor, share your symptoms, and ask for thorough testing. That might include blood work, heart function tests, or imaging studies depending on what your physician suspects. The key is early detection. Catching a serious illness in its early stages can mean the difference between recovery and irreversible damage. Finally, remember this. Your body doesn't lie. It knows when something is wrong, and it always tries to warn you, whether through pain, fatigue, shortness of breath, or subtle changes in how you feel each day. Extreme fatigue, especially when unexplained and ongoing, is one of the most urgent warnings your body can send. It's not just being tired, it's a potential sign that your body is in crisis. The sooner you take action, the greater your chances of identifying the root cause and getting the treatment you need. Don't wait for things to get worse. Listen to what your body is telling you, because it might be crying out for help before it's too late. Number 2. Sudden and severe chest pain or pressure. There are few sensations more alarming and more dangerous than a sudden, intense pain or pressure in your chest. It's the kind of feeling that makes everything stop, the kind that grabs your attention and refuses to let go. If you've ever experienced a crushing, squeezing, or heavy sensation in your chest that seems to come out of nowhere, especially if it spreads to your arm, jaw, neck, shoulder, or back, you need to treat it as a red alert. This is not a moment to wait and see. This is not something to push through or explain away as indigestion or stress. Doctors are clear. When someone reports chest pain that feels like this, they treat it as a possible heart attack until proven otherwise, because waiting even a few extra minutes can be the difference between life and death. The truth is, when your heart is in trouble, it often sends out one of the most urgent and unmistakable distress signals through your chest. This pain may feel like a heavy weight pressing on you, a tight band squeezing your chest, or even like someone is standing on your ribs. It might start gradually, building over several minutes, or it might strike suddenly like a bolt of lightning. Some describe it as an elephant sitting on their chest, making it hard to breathe. Others say it feels like burning, tightness, or an ache that radiates outward. No matter the exact description, the message is the same. Something is very, very wrong. One of the biggest mistakes people make is underestimating this symptom. They chalk it up to heartburn, anxiety, or a pulled muscle. They try to tough it out, hoping it will pass, but in reality, every second counts. If you're having a heart attack, the heart muscle is being starved of oxygen, and the longer you wait, the more damage is done. In some cases, that damage is irreversible. In others, it's fatal. And here's what makes it even more dangerous. Heart attacks don't always look like the dramatic Hollywood portrayals we're used to. Not everyone clutches their chest and collapses. Some people experience only mild chest discomfort paired with nausea, dizziness, sweating, shortness of breath, or an overwhelming sense of doom. Others feel pain in the upper back or arms without any chest pain at all. That's why so many people ignore the early signs, and why too many don't make it to the hospital in time. Even more frightening is the possibility that the pain you're feeling isn't a heart attack at all, but something just as deadly, if not more so. A sudden, sharp, tearing pain in the chest that radiates to the back or abdomen could indicate an aortic dissection. This is a catastrophic event where the inner layer of the aorta, the body's largest blood vessel, tears open, allowing blood to flow between the layers of the artery wall. This can cause the aorta to rupture, leading to rapid internal bleeding and death if not treated immediately. It's one of the deadliest emergencies in medicine, and its first symptom is often a ripping or stabbing pain that people don't understand until it's too late. So, what should you do if you ever experience chest pain like this? The answer is simple, and it could save your life. Do not wait. Do not try to lie down, drink water, or calm yourself and see if it passes. Do not waste precious time searching the internet for answers or telling yourself it's probably nothing. Call emergency services immediately. Let the professionals determine what's going on. It's always better to get checked and find out it was something minor than to hesitate and lose your only window for treatment. Emergency responders are trained to handle these situations. They can administer life-saving medications, monitor your heart, and get you to a hospital quickly, giving you the best chance at survival. Your body knows when something is seriously wrong, and chest pain is one of its most powerful cries for help. Never ignore it, never downplay it, and never assume you're too young or too healthy to be at risk. Heart attacks and aortic dissections don't care about your age, your job, or your plans. They strike without warning, and often without a second chance. Listen to your body. It just might be the warning that saves your life. Number 3. Difficulty breathing or shortness of breath. Imagine you're sitting quietly, maybe reading a book, watching TV, or just relaxing, and suddenly out of nowhere you feel like you can't get enough air. You're not climbing stairs, you're not running a race, and yet it feels as if the oxygen in the room has vanished. You take a deep breath, but it doesn't help. The tightness in your chest builds, and each inhale feels shallow, ineffective, like trying to breathe through a straw. This isn't just discomfort or anxiety, it's your body sending out a desperate alarm. Unexplained shortness of breath, especially when it comes on suddenly or worsens over time, is one of the clearest signals that something serious is happening internally, something you should never, ever ignore. Doctors are trained to see this symptom as a top priority because it's often linked to potentially fatal conditions. One of the most dangerous culprits is a pulmonary embolism, a blood clot that travels to your lungs and blocks the flow of blood and oxygen. It can strike quickly and without warning. You might notice a little pain in your chest or back, a feeling like you're winded after mild activity, and then, before you know it, you're gasping for air. Pulmonary embolisms are especially common after long periods of inactivity, like during a long flight, after surgery, or even after being on bed rest. If not caught and treated immediately, a pulmonary embolism can stop your breathing entirely and lead to death in minutes. Another hidden danger behind shortness of breath is congestive heart failure, a chronic but often misunderstood condition where the heart can't pump efficiently. As a result, blood and fluid back up into the lungs, making it harder and harder to breathe. You may find yourself getting winded while walking across the room, or even struggling to catch your breath while lying flat. Some people wake up in the middle of the night, gasping for air, drenched in sweat, with an urgent sense that something is terribly wrong. That's not just stress or a bad dream, it's your heart crying out for help. Left untreated, heart failure can progress rapidly and become life-threatening. But one of the most overlooked causes of breathlessness is perhaps the most terrifying, a silent heart attack. Unlike the stereotypical heart attack, which involves dramatic chest pain and collapse, a silent heart attack can sneak in under the radar. It might come in the form of extreme fatigue, mild nausea, cold sweats, or, most notably, shortness of breath. It doesn't always hurt, it doesn't always stop you in your tracks, but it can still do just as much damage. In fact, many people only realize they've had a heart attack days or weeks later, sometimes only after permanent damage has been done to the heart muscle. That's why shortness of breath that you can't explain is never something to take lightly, and the danger doesn't end with the heart. Serious lung conditions like pneumonia, chronic obstructive pulmonary disease, COPD, or even lung cancer can also present as persistent breathlessness. Sometimes these illnesses develop gradually, making it easy to mistake the symptoms for aging or poor fitness. But if you find yourself getting short of breath doing things you used to handle with ease, walking to the kitchen, talking on the phone, even standing in the shower, that's a sign something deeper may be wrong. So what should you do if this happens to you? First, don't panic, but don't ignore it either. Sit down, stay calm, and pay close attention to what your body is telling you. If the shortness of breath comes on suddenly, is accompanied by chest pain, dizziness, rapid heartbeat, or fainting, call emergency services right away. Even if the symptoms seem to fade, don't shrug it off. Make an appointment with your doctor, get the tests, and find out what's happening inside your body. Breath is life, and when it becomes difficult, it's often because something critical is failing. The ability to breathe freely is something we often take for granted until it's gone. That feeling of air hunger, of not being able to fill your lungs, is one of the scariest experiences a person can have, and for good reason. It's your body's way of shouting that it needs help now. Don't ignore that voice. The sooner you act, the better your chances of preventing a deadly event and reclaiming control over your health. Number 4. Drastic and unexplained weight loss. At first glance, losing weight without trying might seem like a welcome surprise, especially in a world where so many people struggle to shed unwanted pounds. But when those pounds start disappearing without any changes to your diet, activity level, or lifestyle, it's not a gift. It's a warning. Unintentional weight loss is one of the most overlooked red flags in medicine, and yet it can be one of the earliest and clearest signs that something inside your body is seriously wrong. Doctors take this symptom extremely seriously, particularly when the weight loss is rapid, noticeable, and comes with no obvious explanation. If your clothes are hanging more loosely, if your face starts looking hollow, or if the scale keeps dropping, even though you're eating the same way you always have, it's time to stop and listen to what your body may be trying to tell you. One of the most alarming reasons for sudden weight loss is cancer. Certain types, especially pancreatic, stomach, lung, or esophageal cancers, can cause significant weight loss early in the disease process, sometimes before any pain or discomfort ever shows up. The reason? These cancers hijack your body's metabolism, causing it to burn energy faster than usual while also interfering with how nutrients are absorbed. The result is a dangerous kind of weight loss where both fat and muscle mass melt away, leaving you feeling weaker, more tired, and increasingly vulnerable. People often don't suspect cancer because the symptoms are subtle at first. Maybe you're not as hungry as you used to be, or maybe food just doesn't taste right anymore. But the weight keeps dropping, and your body slowly begins to waste away, sometimes silently. But cancer isn't the only threat. Severe metabolic disorders such as undiagnosed diabetes, especially type 1 diabetes, can also trigger rapid weight loss. When your body can't properly use sugar for energy, it starts breaking down fat and muscle to survive, causing dramatic changes in your weight and strength. Similarly, heart failure and kidney disease can interfere with appetite, digestion, and nutrient absorption, often causing a decline in weight that mirrors the decline in organ function. These are not just numbers on a scale, they are signs of the body slowly shutting down, piece by piece. Another commonly overlooked cause: chronic infections and inflammatory diseases. Conditions like tuberculosis, HIV, Crohn's disease, rheumatoid arthritis, or autoimmune disorders like lupus can put your immune system in overdrive. When that happens, your body starts consuming energy at a much higher rate, leading to weight loss even if you're eating normally. Long-term inflammation also disrupts the hormones that control hunger and metabolism, compounding the problem. Over time, you may find yourself feeling cold, fatigued, and frail, symptoms that sadly many people attribute to aging when they could be signs of something much more urgent. Then there's the emotional side. Mental health conditions like depression or anxiety disorders can drastically alter eating habits, leading to skipped meals, loss of appetite, and eventually a noticeable drop in weight. The danger here is double. Not only does your body suffer, but the root cause, your mental well-being, often goes untreated. People suffering from these conditions may not even notice the weight loss at first, or they might even welcome it, not realizing that it's tied to something far more dangerous than diet. So, what should you do if the pounds are falling off and you don't know why? The first step is to track it. Take note of how much weight you've lost and over what period of time. If you've lost more than 5% of your body weight in less than 6 months without trying, say 10 pounds off a 200-pound frame, that's a red flag you can't afford to ignore. Even if you feel okay otherwise, unexplained weight loss is never something to take lightly. Visit your doctor and be honest about what you've experienced. Insist on a full physical exam, comprehensive blood tests, and scans if needed. Don't settle for vague reassurances or wait to see if it improves. Your body is trying to tell you that something is wrong, sometimes far below the surface, and the sooner you act, the better your odds of catching it, before it becomes something irreversible. Remember, weight loss should be intentional, controlled, and healthy, not a mystery. When it starts happening without a cause, it's no longer a sign of success. It's a symptom of crisis. Don't ignore it. Don't dismiss it. Your life could depend on it. Number 5. Confusion, disorientation, or sudden personality changes. There's something deeply unsettling about watching someone you care about suddenly change before your eyes, or even worse, realizing that your own mind doesn't feel quite right. If you or someone close to you starts acting strangely, forgetting basic things, becoming easily confused, or behaving in ways that are completely out of character, it's not just a bad day. It could be a sign that something far more dangerous is happening within the brain. Doctors stress that sudden changes in cognition or personality are among the most alarming warning signs they encounter, because they often point to a life-threatening medical emergency. Whether it's the result of a stroke, a serious infection, or a rapidly progressing neurological condition, these changes should never be ignored. One of the most immediate and dangerous possibilities is a stroke. A stroke doesn't always come with dramatic physical symptoms like paralysis or slurred speech. Sometimes the only clue is a sudden inability to think clearly. You might forget where you are, what you're doing, or who you're talking to. Words might not come out right, or you might lose your ability to understand what others are saying. In some cases, people experience what's called a transient ischemic attack, TIA, or mini-stroke. This can cause brief episodes of confusion, personality changes, or odd behavior that seems to pass quickly, but it's a powerful warning shot. TIAs often come before a major stroke, and getting help immediately could prevent a devastating outcome. But strokes aren't the only culprits. Infections, especially in older adults, can wreak havoc on the brain in shocking ways. A simple urinary tract infection, pneumonia, or even the flu can lead to delirium, a state of sudden and severe mental confusion. Unlike dementia, which typically develops gradually, delirium can appear in a matter of hours or overnight. A person who is completely coherent and alert in the morning might suddenly seem agitated, paranoid, or totally disconnected from reality by nightfall. They might not recognize loved ones, may lash out verbally, or may sit in silence, unable to focus or respond. This is not a psychological problem. This is the body's immune system struggling to fight off a threat, and in doing so, disrupting normal brain function. And if left untreated, it can become fatal. Then there are neurological conditions like Alzheimer's disease, Lewy body dementia, or frontotemporal dementia, which affect not only memory but also personality and behavior. Although these illnesses typically progress over time, there are cases where symptoms seem to accelerate or appear suddenly. A person may lose track of conversations mid-sentence, forget recent events or appointments, become withdrawn, or start behaving inappropriately in social situations. These changes can be terrifying, both for the individual experiencing them and for the people around them. What's especially heartbreaking is how often these signs are mistaken for normal aging or just stress. But memory loss is not a standard part of growing older, and dramatic shifts in personality are never normal. They are red flags that something serious is going wrong in the brain. Mental health conditions like depression, bipolar disorder, or even psychosis can also lead to rapid personality changes, often triggered by underlying physical illness or extreme stress. Sometimes a person becomes emotionally flat or unresponsive. Other times they may become erratic, impulsive, or deeply anxious seemingly overnight. These conditions are real, serious, and deeply tied to brain chemistry. And just like with a stroke or infection, early intervention can make a huge difference. So, what should you do if you, or someone you know, starts showing signs of confusion, memory problems, or behavioral changes that seem out of the ordinary? Don't wait. Don't assume it's just aging or that it'll pass on its own. Seek medical attention right away. Pay attention to how fast the symptoms came on, whether they're getting worse, and if they're affecting everyday activities. The earlier you get help, the better the chances of identifying the root cause, whether it's treatable, reversible, or requires long-term care. When it comes to the brain, every second truly matters. The sooner you act, the more likely you are to protect the mind, preserve quality of life, and possibly save someone from a much worse outcome. Number 6. Severe and persistent abdominal pain. Most of us have experienced a stomach ache at some point in our lives, perhaps after a large meal, stress, or an uncomfortable night of sleep. But there's a huge difference between a typical stomach ache and the kind of pain that suddenly takes your breath away and refuses to let go. Doctors warn that severe, persistent abdominal pain, especially if it comes on suddenly or lasts for hours, can signal that something inside your body is dangerously malfunctioning. One of the most immediate and deadly concerns is a ruptured abdominal aortic aneurysm. The aorta is the largest artery in the body, and when a weakened section of it bursts, it causes catastrophic internal bleeding. The pain from this condition is often described as deep, intense, and constant, sometimes with a pulsing or tearing sensation that feels like it's radiating from your abdomen to your lower back or sides. Imagine the feeling of something ripping or tearing inside your body with every heartbeat. This kind of pain demands immediate medical intervention, Without it, survival chances rapidly decline. However, the threat doesn't end there. Another potential cause of severe abdominal pain is intestinal ischemia, a condition where blood flow to the intestines is suddenly restricted, often by a clot, twisted bowel, or advanced cancer. The pain from ischemia can be crippling, with symptoms that include a swollen abdomen, tenderness to the touch, and a feeling of fullness or bloating. If you haven't had a bowel movement in a while, or if your belly feels hard or distended, this could be a red flag. The lack of blood flow to the intestines leads to tissue damage, which can cause deadly complications like sepsis and organ failure if not addressed quickly. There's also pancreatitis, a condition where the pancreas becomes inflamed, often due to gallstones, alcohol use, or a high-fat diet. The pain from pancreatitis typically starts in the upper abdomen and can radiate to the back. It can be so severe that even the simplest of movements becomes unbearable. Eating can make the pain worse, and the discomfort doesn't subside on its own. Left untreated, pancreatitis can lead to organ failure, shock, and even death. Additionally, gallbladder disease can present as sharp, stabbing pain under the ribs, especially after eating a fatty meal. Many people mistakenly think this is just indigestion or heartburn, but if a gallstone blocks the flow of bile, it can lead to serious infection or inflammation in the gallbladder. This condition requires immediate attention, as delayed treatment can result in life-threatening complications. Another common mistake people make is ignoring gastritis or ulcers, which can cause sharp burning pain in the stomach area. While they are not always fatal, if left untreated, they can lead to internal bleeding and other severe complications. But regardless of the exact cause, the key takeaway is this: when you experience sharp, persistent abdominal pain that doesn't improve or comes on suddenly with alarming intensity, don't wait for it to pass. Your body is telling you that something is wrong, and ignoring the warning signs could have dire consequences. Seek immediate medical attention, especially if the pain is accompanied by other symptoms such as fever, vomiting, dizziness, fainting, or sudden weakness. In many cases, conditions like these require urgent surgery or other interventions to prevent life-threatening complications. So, if you're experiencing any of these symptoms, don't dismiss them as just a stomach ache. It could very well be a medical emergency, and the sooner you seek help, the better your chances of survival and recovery. Number 7. Persistent headaches or sudden changes in vision. Headaches are something most of us experience at one point or another, whether due to stress, lack of sleep, or dehydration. But when headaches become persistent, severe, or change in character, it's time to pay attention. Doctors caution that chronic or sudden onset headaches can sometimes indicate a more serious underlying issue, particularly if they are accompanied by sudden changes in vision, nausea, or difficulty speaking. A sudden intense headache, often described as the worst headache of your life, could be a sign of a brain aneurysm, which occurs when a weak spot in a blood vessel in the brain balloons and can potentially rupture. This is a medical emergency that requires immediate intervention. Another serious condition associated with persistent headaches is increased intracranial pressure due to a brain tumor or an infection like meningitis. In these cases, headaches often become worse over time, especially in the morning, or with any kind of physical exertion. If you suddenly experience blurred vision, double vision, or loss of vision along with your headache, it could signal optic neuritis, a condition related to inflammation of the optic nerve, or it could be a sign of glaucoma, a condition where pressure inside the eye becomes dangerously high. Additionally, headaches that come with visual disturbances, such as seeing halos around lights or auras, could be indicative of a migraine with visual aura, but they can also be linked to other neurological issues that need medical attention. So what should you do? If your headaches are becoming more frequent, severe, or are accompanied by other unusual symptoms like vision changes, nausea, or difficulty with balance or coordination, it's crucial to see a doctor. Do not wait for the pain to subside on its own, because when it comes to your brain and vision, delaying treatment could have devastating consequences. Seek medical help immediately for an accurate diagnosis and to determine the cause. If you've made it this far, congratulations. You're now more aware of how important it is to listen to the subtle and not so subtle signals your body sends you when something's wrong. Your body doesn't usually scream for help right away, but it does offer you warning signs long before disaster strikes. And while it might seem like small annoyances at first, these signs can indicate something much more serious, potentially life-threatening if ignored. The key is recognizing these signals early and taking swift action. We've covered 6 major warning signs that doctors consider red flags for serious health conditions: sudden chest pain, unexplained weight loss, shortness of breath, confusion, or severe abdominal pain. These are not symptoms you can afford to dismiss or hope will simply go away on their own. The truth is, ignoring these symptoms, or brushing them off as nothing, could lead to irreversible consequences. Whether it's a heart attack, a stroke, cancer, or something else, timely intervention could mean the difference between life and death. When you feel something is off, no matter how small it may seem, trust your instincts. Your body is a finely tuned machine, and when it starts acting differently, it's often trying to tell you that something isn't right. It's far better to err on the side of caution and seek medical attention, only to be reassured it's nothing serious, than to wait and regret not acting sooner. As we grow older, we may forget that our health can change in an instant. We can become complacent or assume that we're just getting older. But one of the greatest powers you have is knowledge. Being informed gives you the ability to take control of your health. Knowing the warning signs empowers you to take action at the right time, potentially preventing more serious issues down the road. Now, I'd love to hear from you. Have you or someone you know ever experienced one of these warning signs? What did you do about it? Sharing your story could help someone else recognize a potentially dangerous symptom before it's too late. Your experience might just save someone's life. Thank you so much for joining us today. We truly appreciate your time and attention. Please take a moment to leave a comment below and share one thing you learned from this video or how you plan to use this knowledge to improve your health. Your feedback is incredibly valuable, and reading your thoughts motivates us to keep creating content that helps you live a better, healthier life. If you found this video helpful, please give it a thumbs up, subscribe for more insightful content, and share it with your loved ones. Your support helps us keep bringing you important, life-saving information. Thanks for watching, and we can't wait to see you in our next video. Stay healthy, stay informed, and take care of yourselves.